Good.
Good afternoon. I'm Dr. Dale Bratzler. I'm the Enterprise Chief Quality Officer here at OU Medicine and the University Chief COVID Officer for the University of Oklahoma. I'm going to give you a brief update on where we're at with COVID-19. I know there's a lot of news today about a very prominent person who became infected this week, so we'll talk about that also. So in Oklahoma, we're just under 90,000 cases in our state with 1,009 deaths in the state. And if you want, I've put that into a different perspective recently. If you averaged out all the cases and the deaths that have occurred in our state since the start of this pandemic, we've seen on average more than 420 new cases of COVID-19 every single day since the pandemic started, and more than 5 deaths, or right at 5 deaths per day for people in our state during the period of this pandemic. Obviously, we're seeing more cases now and more deaths now as the case count has gone up considerably. We're just over 1,000 cases a day right now with respect to the 7-day rolling average. That's the number of cases that we see, newly diagnosed cases each day. And the percent of tests that have been tested in the past week that have been positive is 9.2%, which is up slightly over the past 2 weeks in terms of percent positivity. I think the biggest concern that many of us have had recently has been the number of hospitalizations. If you look at people who have a confirmed diagnosis of COVID-19, a positive test, we're at the highest level ever in terms of number of people in the hospital with a confirmed diagnosis. And again, we have more than 200 people that are in the intensive care unit with COVID-19. So I think it's just really important we remember that we're not through this yet. We're going to see more deaths in our state because we have such a large population of Oklahomans that are sick enough to be in the hospital and also sick enough to be in the intensive care unit. Obviously, the big news today was that the president and his wife have tested positive for COVID-19. And I'm only going to highlight one key point that I think I want to keep making that's very, very important. It doesn't matter who you are. If you're in an indoor setting around people and you're not wearing a mask, you increase the likelihood of transmission of this virus, that you can get it or you could give it to somebody else. That's simply a known fact now, that the principal way that you get this infection is to breathe droplets into your mouth and nose that have come out of somebody else's mouth and nose. That's how you get this infection. And so we shouldn't be surprised, because it's been well known that the president has not consistently used masks in all of his interactions. And again, he puts himself into circumstances around other people where the virus may be in the air. So that's just really important. The virus is nonpartisan. It's not denominational. It affects all classes of people, all races. It definitely affects some races and some socioeconomic categories of people more so than others. But anybody can get this infection if you put yourself at that risk of being in an enclosed indoor setting, not wearing a mask, and close to other people. That increases the likelihood of the infection. The other comment I wanted to make today is that there's pretty good research now that shows that it's incredibly important to wear your mask covering both your nose and your mouth. We know that the most receptors in your body to which this virus attaches are in your nose. And so if you're breathing, obviously, and somebody else is around you that's not in a mask, your nose is highly susceptible to take in the virus, because most people breathe through their nose when they're being comfortable, and that's where the virus can get in and attach to those receptors that are in the nose. Second, when you get infected, the largest concentration of the virus is also in the nose, and so when you exhale, when you're breathing, particularly through your nose, you can release a lot of virus while breathing, and obviously when you sneeze or cough. So it's incredibly important that you wear your mask properly and cover both your nose and your mouth when you wear the mask, to reduce the risk of transmitting the virus to somebody else, but also reduce the risk of getting the infection yourself.
Okay.
to a little bit more about the president. Hunter at News 9 was wanting to know how, with that occurring, do you think that will change the contact tracing and the importance of keeping everyone safe during this election? Do you think that we'll be seeing some different things going on with that?
Well, so typically, if a person tests positive for COVID-19, you're contacted by either the state or the county health department for contact tracing. And the first thing that they do is called the case investigation, where they talk to you about where your possible exposures were, and also who you've been into contact with, typically for the 2 days prior to your test. So that's very important, because those are the people who are most at risk, because we know that you shed the virus usually for 2 to 3 days before you develop symptoms or before you decide to get tested. So I think it's likely that the president has been infected for several days. It didn't happen just from this recent one-day flight. He's probably been infected for several days and has probably been shedding virus for several days before the test turned positive. So the usual, the usual routine would be to contact all the people that an infected person had been in contact with for the past 2 days. Typically, we recommend that they get tested, but also then that they go into quarantine for at least 2 weeks.
Rick at Fox 23 in Tulsa just texted that he was asking if there's an elevated risk for the president because he's 77, has high cholesterol, and is considered overweight, as opposed to the first lady.
Yeah, so if you just look at what we know, population demographics of the people who have complications, hospitalization, and even death from COVID-19, older people are at greater risk. So if you look at Oklahoma data, about 79% of the people who have died from COVID-19 have been over the age of 65. So age definitely puts you at greater risk. Obesity is a well-known risk factor for the complications of COVID-19, even in young people. It increases the risk of complications. And of course, any other underlying chronic disease like heart disease, lung disease, liver disease, kidney disease, all can put you at increased risk of the complications. So the mere fact that the president is above the age of 70 and also is by definition obese, he is at greater risk of the complications of COVID-19. And of course, his wife is younger and probably has less risk factors.
Okay. And so just kind of overall comment, Angelica Page was asking about just if this maybe will change the way hopefully society looks at mask wearing, and maybe that even reconsidering a statewide mask mandate for Oklahoma. Obviously, you don't have a crystal ball, but
yeah. So I can't answer what our governor might do or what other governors in other states might do. But I just keep going back to the primary thing that we've learned about this virus. The vast majority of people who get this infection breathe droplets into their mouth or nose that came out of somebody else's mouth and nose, typically somebody that was close, and typically close to somebody who was not wearing a mask. And so if you put yourself into those circumstances where you're around other people, you just have to recognize you increase your risk of infection if you're not wearing masks or if both people are not wearing masks. The other point I'll make is that I just gave a lecture to some of our students on campus a few moments ago, and I highlighted that a person can look perfectly healthy, they can feel fine, and they could have the infection and potentially be spreading the virus. So my comment is practice what I call universal COVID precautions. Simply recognize that anybody you encounter could have the infection, and you need to protect yourself by wearing a mask, try to maintain physical distancing, and of course then doing the other public health practices like hand hygiene and enhanced disinfection.
Okay. Let's change gears. The reporter's asking, a recent study finds cases in children have jumped from 2 to 10%. Can you speak to the growing concern of COVID cases in children?
Yeah, so even in Oklahoma, we've seen an increase in the number of cases in young people. So the biggest group of new cases in Oklahoma today is in the age group 15 to 24, which would include your high school students through your college students. Perhaps not surprisingly, as we opened schools and started seeing more interaction again with young people. The same thing's happening with school-age children, as we know that they increasingly are around other kids and can acquire this infection. There's pretty good data now that kids do get this infection, and they probably spread this infection. They don't get nearly as sick. They're often asymptomatic or have minimal symptoms, and luckily most of them do not end up in a hospital or have any severe complications. But it is clear that young kids can get this infection and spread it to other people.
Okay, do you have any new updates on the vaccine and or timeline?
Yeah, I haven't heard any new updates. I hope to get an update a little bit later today. I expect before the end of the year, hopefully one of the vaccines, one or two, will be presented to the FDA for possible approval. We don't want to rush that process. And I know that many of the vaccine manufacturers that are doing the tests currently are already manufacturing vaccine so that there'll be doses ready to distribute once they get FDA approval. But again, no vaccine manufacturer is going to be able to produce the number of doses that are going to be needed to get wide-scale distribution in the United States or any other country at this point. So I do think it'll be well into next year before we see wide-scale availability of vaccine, whichever one gets approved by the FDA.
Okay. Speaking of vaccines, it kind of lends itself to discuss flu real quick. As cold and flu season gets here, do you have any idea of how influenza and COVID can impact a person at the same time?
Yeah, so we know from the early part of this pandemic, which, as you will recall, started during last flu season, that there were people who were infected with both viruses at the same time. I don't know that there was any, there weren't enough cases to know how it might impact somebody with respect to the severity of the illness, but we know it is possible to be infected with both influenza and with the COVID virus at the same time, so we know that. The other thing we know is that every year when people get infected with influenza, it increases rates of hospitalization, and we already have hospitals that are relatively full, particularly with our ICU beds filling up because of COVID-19 patients. So if we were to have a bad flu season, I think we could see overwhelming our hospital capacity pretty quickly. And so it's just going to be exceedingly important this year that everybody go out, seek it out, get a flu vaccine to protect yourself.
Okay, well that is a perfect segue into Corey from the Tulsa World wants to talk some about Stillwater's hospital situation regarding beds and COVID. What's happening there and why?
Yeah, so I talked to one of the physicians from Stillwater. They had a number of patients get transferred in. One of the points I've made about COVID in Oklahoma is that we've seen it move fairly steadily into the rural communities of our state, rural communities and rural counties. And so if you actually look at the population incidence of COVID-19, it is higher in many of our rural counties now than it is in Tulsa, Oklahoma County, or Cleveland County, our most populous counties. Even though they have more cases, they're not having as many cases per population. And so what's happening is, talking to the physician, they were starting to see transfers of COVID patients that were coming from smaller communities that don't have the capability or may not have ICU beds to take care of these patients. And so they had actually opened up an additional 5 beds or so to try to take care of the extra load of patients that they were seeing. And there were some transfers from metropolitan areas, both around the Metroplex, but also some transfers. A couple of patients were transferred from regional hospitals over to Tulsa when we saw that big spike in cases in northwest Oklahoma. What I'm hoping now is if we get the outbreaks under control that are happening in correctional facilities, that perhaps we can see the case counts start to slowly trend back down. But again, until people consistently wear a mask and try to avoid crowds and do physical distancing, we're still going to see community transmission of the virus.
Okay, so you are saying that some of the patients from that area have been transported to Tulsa and Oklahoma City?
I happen to know one of the medical directors in Tulsa that called me and basically said, why were patients coming to Tulsa, and when I looked, we had filled up a good chunk of the ICU beds in the Oklahoma City metropolitan area, and it was getting difficult to find new beds for COVID patients for a short period of time. So there were a few patients from the Oklahoma City metro area that were transferred over to Tulsa.
Oh, and I was thinking we were talking about from Stillwater, so even from Oklahoma City.
Yeah.
sometimes. So that was his final question, was just kind of what did the hospital situations look like in the metro areas?
Yeah, so I don't have good updated numbers for the entire metro. I think it's a little bit better than it was last week, but there are still a substantial number of COVID-19 patients in the hospital. And again, if you look at the state numbers, we have more confirmed cases of COVID-19 in the hospital today than we've ever had throughout the entire pandemic. The people who have a positive test get sicker, more of them are in the ICU, and so it is concerning, and we're hoping that we see that number start to drop off as the number of new cases in the state hopefully starts to drop off.
Okay. That's all the questions we had today. Is there anything we want to sum it up with?
Encourage everybody to go out and get your influenza vaccine. Very, very important.